I'm Dr. Warwick, your local Lacey, Olympia chiropractor here, and we have Michelle, who is a nurse at Madigan. And what department do you work in?
Anesthesia.
Anesthesia. And she's come in for chiropractic care, so I'm going to take you through and demonstrate some of the chiropractic adjustments. I'll try to explain what I'm doing, how I'm doing it. Where would you like me to focus today, Michelle?
Mostly upper shoulders.
Upper shoulders,
and back.
okay.
Upper back.
So a lot of times, and not everything, some people start, some of the chiropractors start with their patients sitting up. So I'm going to go through what's called a basic scan or basic protocol in checking her out and seeing the alignment of the spine, but we're going to put most of our effort in the upper mid-back, lower neck area where she asked. Okay, so I start out and I look at the leg length. So short leg, about 3/4 of an inch right side. Goes longer in position 2 and longer in position 3. So we have a misalignment in the pelvis. So I feel both sides of the joints. It feels more on her right side. So I'm using a technique called Thompson technique. Different tables chiropractors use. So I typically, with a drop type piece, it's a way to adjust the body, adjust the misaligned bones. So I'm putting pressure more on the right side than left. And then with each adjustment, it gets a little bit firmer. Okay, both legs even, position 1 and 2. And her legs started to move easier as I tracked. A lot of times also low back pain, number one thing that we notice with people, tight hamstrings. We do a lot more sitting and I can feel it mostly on her right side right there. So I'm going to use the instrument just to loosen the tight hamstrings. Right on the outside. So people get that low back pain. A lot of times we'll see the tight hamstrings there. Okay, go ahead. Put your right hand on your lower back for me. Switch hands. And back. Now, have you been doing the training for the half marathon?
Oh, yeah.
Didn't you just do one?
I've done 2 in the last 3 weeks.
I didn't know 2. Good for you. And I usually see Michelle when she needs to get in here for her tune-up, just to make sure she's running straight, right?
Mm-hmm.
Otherwise you run one big circle.
That always sucks.
Alright, so as I was going through and palpating, some of the areas around T4, T6 started to loosen up and release in the spine. You can see the adjustments don't have to be very hard on people. But aligning the spine reduces the pain, eliminates that neck and back pain. Go ahead, turn your head to the right, back to the middle. So we check T6 again, we check C7 when she moved her head back. Go ahead, lift your head up and back down. Checking C5. Tuck your chin to your chest, checking the atlas bone and relax. Right leg went quite a bit short, about 3/4 inch short. I know the camera can't pick this up. So I see some stress over the atlas bone. And this area right here in the neck creates a lot of problems that people will see that can even attribute down to the low back pain. So I check the atlas, the top bone or C1 in the neck. That bone can misalign and be adjusted 21 different ways. So I'm using an instrument called the integrator to adjust the atlas bone right there. Good. Good. Take a deep breath in and release it. Good. Now I'm going to have you sit up, face the direction toward the windows. When patients complain a lot about their mid-back, between the shoulder blades, I like to check the ribs. I could feel it more on her right side than on her left. So we have typically a T1 rib. And I check the shoulders, helping the blades come backward. A lot of times, because of the work that we do, where we sit at a computer, the shoulders tend to roll forward if we drive, those kind of things. All right, there we go. You want to say anything to the viewers out there, Michelle?
I've been seeing Dr. Warwick for a couple of years now, and he's always done a great job helping me get back so that I feel like I'm not leaning more towards one side or the other whenever I'm running.